Sorry, I think the camera completely zoned out there because I was talking for too long. So yeah, as I was saying, I don't really, I'm able to, live my life, which I'm very lucky for. However, so I started on azathioprine, started on prednisolone. Prednisolone was a horrible, horrible drug. I hate it. There's no, there's no two ways about it. It saves your life, but it's horrible. It's, yeah, a complete and utter horrible drug. It makes you feel, well, it makes me feel anyway, like I'm not really myself. So at high doses, it can cause personality changes, mood swings. I remember the first time I had it, I felt so happy. I mean, this was around exam time in my third year of university, so I probably wasn't in the best mental state anyway, but I would feel so happy, and then really sad, and then really happy, and then really sad. It was horrible. You get, like, it's called moon face, so you begin to look like a member of Alvin and the Chipmunks. Basically just because it alters the fat distribution in your body. It causes you to retain weight or gain weight. It causes increased appetite. It causes you to hold on to fluid retention. It causes you to hold on to water. It messes with your digestive system. It causes you to get like increased susceptibility to infections, so things like bladder infections, thrush, you name it, more likely to get it. It causes your skin to thin, so you burn more easily and you bleed more easily if you cut yourself. You don't heal as fast. So it's just a wide, and that's just the cosmetic stuff. Long term, if you're taking steroids for like the rest of your life, you're at high risk of getting osteoporosis. So it doesn't allow your body to take calcium from your food, absorb calcium, and you obviously need that for your bones. So your bones don't get enough calcium, and over time, and I'm talking years and years and years at sort of, reasonable doses, this can lead to bone thinning. Yeah, but for me as well, one of the biggest bummers about prednisolone is that I'm pretty sure that it's caused my hair to fall out. So this is not my real hair. I have very thin hair, which is just unmanageable and horrible. And I think that that is probably the biggest psychological part of my disease, is learning to cope with losing my hair, which sounds pathetic. And even as I say this now, you feel so weak for being this way. But I think as a young girl, it is honestly so difficult to come to terms with, and you feel like such a weirdo if you don't have lovely, beautiful hair. But I say that in a moan, but whenever I go to a doctor and say this, you do feel a bit stupid, because they're dealing with people who are dying, that don't have a life because they're dealing with liver damage, or they're on a transplant list. And it's very hard to moan about your hair being, rubbish when you're able to go and work and live and eat normally. So it's just about getting that perspective, but I think that it's still taken me time to get that perspective, attitude. So yeah, that's one of the key things that I find very difficult to cope with. And not many people know that this isn't my real hair. I don't tend to speak about it a lot with my friends, or people that I know, just because it's such a personal thing. And I think that if you didn't know about my liver history, you wouldn't necessarily know that I'm ill, which I quite like. But as soon as you say to someone, this isn't my real hair, then it's an outward sign of your illness, which I don't like. Because it's like a constant reminder that you're ill. When I take this hairpiece off at night, I look like, I always think I look like Michelle Pfeiffer from, the old witch in Stardust, that's just got like straggles of hair, or like that pirate in Pirates of the Caribbean, which is a bit of an over exaggeration, but you know what I mean. yeah, but it's just quite sobering, even though I'm permanently sober. It's sobering when you look in the mirror at night time and you see that, and it's just, sometimes it's quite upsetting. But I've cried many tears about losing my hair, and there's nothing I can do about it. You know, I eat well, I try not to stress, you know, I do everything I can to stay healthy. So, you know, there's no more I can do from my side. So I've just got to accept it. But other than that, I've had a couple of flares of autoimmune hepatitis. So what I mean by that is, initially I was started on prednisolone. That brings your numbers down and you go into remission of your condition, and then you enjoy a time of stability when it takes a bit of time to adjust your medication. It's up and down, it takes a while. So, you know, if anybody is watching this and you've just been first diagnosed, it is a horrible time. It's such a whirlwind. There's so much going on. You're reading all this stuff online about, if you have cirrhosis, you know, you're probably reading the Wikipedia page and preparing your own funeral, but don't. And you know, I think a lot of what's the information that's available out there can be very scary and very negative, and whilst there are a lot of people who really do struggle with cirrhosis, autoimmune hepatitis, even lupus, you know, I just want to let people know that you can be able to live a really full life, and it's, you know, just trying to get the balance right between working with your doctors, ensuring that you take your medicines, complying with, you know, your healthcare regimen, and your outlook as well, and just sort of readjusting it to cope with your new diagnosis. And that takes time, and it's a very confusing and upsetting time, but you do get through it, and time is a big healer. You know, and it will always challenge you for the rest of your life, and I'm aware of that, you know, this is something that's not going to ever go away. I sometimes feel that it's a bit like you're having a really bad nightmare that you can't wake up from, and you can dwell on that, you know, and live a miserable life, or you can say, okay, yep, I've been dealt a pretty shitty hand, but there are people who are dealt with so much worse, and I have X, Y, Z to be really grateful for. And when you start focusing on the positive things in your life, I think that's what, sorry, that's not very, scratching my armpit there, that's not very ladylike. I think when you start focusing on the positive things, that's when you can begin to move forward with your life and live with your illness, rather than let it become your life, which is never a good thing. It can't be helped sometimes, but yeah, I try not to let it be the biggest part of my life. It's just a part of my life. So after being on the initial high dose of steroids, I came down, I enjoyed a period of remission, and then I got a cold that was really bad. And for whatever reason, it always seems to be when I get a really bad cold, it triggers off some kind of immune response in me, and it's almost like, you know, everything's tickety-boo, and then I get a cold and my immune system's like, cha, like absolutely kicking off, and causes another flare of my hepatitis, which then calls for another high dose of steroids to try and bring that inflammation down. And it's sort of cyclical like that. So you do enjoy the times when, you know, you're healthy and fine and you're on like 5 milligrams of prednisolone, and then, you know, some idiot doesn't cover their face when they're sneezing, and you end up getting a cold, and yeah, it just is a cycle. And obviously when you have cirrhosis, the sort of amount of flexibility that you have for damaging your liver is much less. So if I didn't have cirrhosis and I had like an okay liver, then you know, it doesn't matter. Well, it matters, but it's not as important that we really clamp down on that inflammation ASAP. but when you have a cirrhosis liver, if that's a word, I think I might just have made that up. If you have cirrhosis of the liver, then you really can't afford to be getting lots and lots of further damage, because it's just going to tip it that little bit more, and that's when you start to see the start of liver failure. Which brings me on to February of 2017. So 4 years I was quite happily living with my illnesses. I had regular checkups with the doctors, I was getting my bloods taken fairly frequently, so when I'm talking about, when you're on high dose steroids for a flare, getting your bloods taken once a week, when things are good and stable, maybe once every 3 months. Or after a sore throat or an infection or what have you. So yeah, I did well in my life, I think. Graduated, I got a job in, firstly in finance, and then I decided I didn't like finance, so I got a job in a pharmaceutical company, which I really enjoyed. And all the meanwhile I was getting, so you have to get ultrasounds of your liver done to check for tumours, to make sure there's no cancer, because when you have cirrhosis you're at a slightly increased risk of getting liver cancer. And then I also got what's called DEXA scans, so this is scans of your bone to check the density of the bone, because as I explained before, the steroids can cause your bones to thin more easily. So I was getting those checks done. I think that was it. Yeah. So then February 2017, drum roll, 2 nights before, no, 1 night before I was due to go on holiday to Copenhagen, I was feeling really tired during the day at work. Like, I felt quite faint at one point, like, whoa, gonna pass out. But I just thought, maybe it's just a bug or something, or I'm just tired. But I didn't really feel like eating, just felt a bit not quite right. And then that night I woke up and felt really sick, and I don't feel sick very often, but I felt very sick, and I was like, right, okay, need to get up. This is at like 2:30 in the morning. Got up, went through to the bathroom, I was like, yep, I'm going to throw up, and I threw up, but I threw up blood, which is horrible. So there's a lot of blood, and I just looked at it in the toilet, and I was like, okay, I think I know what's happened. I think this is my liver causing a varicose bleed. So I, for whatever possessed me, thought that it would be a good idea to drive myself to the hospital. And so I got up, put my hairpiece on, changed my clothes out of my jammies into a dress, got to look good for going to A&E, and I drove myself to A&E. Don't do that, kids. If you ever find yourself having an esophageal bleed, don't drive yourself, just call an ambulance, because that's what they're for. But anyway, I wasn't that ill. So, got myself to A&E, checked myself in. I lived on my own at this point, and I was admitted to the ward, and then in the morning I was told that I needed to have an endoscopy. So an endoscopy is basically just a thin tube, plastic tube inserted down your esophagus, and that's how it's like a little camera at the end of the tube. And using, we did this in physics, so total internal reflection, I think, is some fancy physics term. It allows doctors to see into your esophagus and the top of your stomach, and that's how they can have a look for these varices that I mentioned earlier. And they had to do something called banding, because what was seen was that I had really big varices that were bleeding, and I needed banding. So the banding is basically like a machine that goes down your throat at the same time or afterwards, and it just clips little bands onto the varices, and this causes them to scar. And when they scar, the tissue changes, it becomes scar tissue, and it actually causes the varices to become eradicated. So it's quite painful, and it's a horrible thing. It feels like you're choking, but you can get sedation, so it feels like you're choking, but you don't really remember it. It's kind of like a dream, but a really not nice dream. I was crying at the end of it, which not a lot obviously, but it's just quite horrible. But anyway, it doesn't take long if you have a good endoscopist. So I got the banding done, and that sort of healed up the varices, but they kept on bleeding a little bit, unfortunately, after I got that done. So I was sent home from hospital. Didn't really feel great, which is understandable considering I'd lost quite a lot of blood by this point. My mum and dad did come down, by the way. I wasn't going home on my own. So my mum and dad were looking after me, and over the next few days I honestly have never felt so rubbish before in my life. I just felt really weak. I couldn't go to the toilet. I needed help to walk through. And this goes to show how ill I was. I refused to have Maltesers. I didn't want them, and anyone who knows me knows that I normally can't. Maltesers is like my crack cocaine. I love them. So when I couldn't eat them, I knew that something wasn't right, and they found that my blood count was really quite low, low enough to do a transfusion. So I got called back into hospital, and I was given 2 blood transfusions, and I just can't even begin to describe how amazing I felt after them. Just, like your energy reserves are back up. And on a side note, anybody who is thinking about going and donating blood, absolutely do it. It's life saving, life changing. So please, I'm very thankful to anybody who does that. Same with organ donation. I think it's just, I don't know why people wouldn't, if you're able to, I don't know why you wouldn't sign yourself up to the organ list, because if you would happily receive an organ, then it works that you should give them as well. Same with blood. So anyway, I was in hospital after that blood transfusion, and I was given a follow-up endoscopy for more banding,